HESC 114, Intro to Pharmacology, Chapter 12, Neurologic Drugs. This is the second chapter in Unit 3. There will be one more chapter in this unit. The function of the nervous system is to receive, process, and interpret sensory information from the body and the environment, and it sends motor commands to the muscles. Neurologic drugs are used to treat diseases of the brain and the nerves. On your screen are the learning objectives for Chapter 12. These are also found at the start of your chapter in your textbook. Diseases and conditions of the brain include epilepsy, dementia, Alzheimer's disease, Parkinson's disease, multiple sclerosis, insomnia, and migraine headaches. Anti-epileptic drugs are used to treat convulsions, which are also known as seizures. They are also known as anti-seizure drugs or anticonvulsant drugs. There are 4 common types of seizures. First is an absent seizure. This is sometimes referred to as a petit mal seizure. An absent seizure is characterized by impaired consciousness, but with little to no muscle activity. There is general vacant staring, could be repetitive blinking or facial tics, and all of which last about 10 seconds. Simple partial seizures can also be known as focal motor seizures. A simple partial seizure involves no impairment of consciousness, but includes involuntary but limited localized or focal muscle movements, such as jerking of the hand or turning of the head. A complex partial seizure is also known as a psychomotor seizure. A complex partial seizure is characterized by mildly impaired consciousness with contractions of some groups of muscles and often lip smacking. Tonic-clonic seizure is known as a grand mal seizure. A tonic-clonic seizure is characterized by unconsciousness and excessive total body motor activity, which alternates between muscle rigidity, known as tonic, and muscle jerking of contractions, which is known as clonic. This includes jaw movement, tongue biting, and urinary incontinence. This is what most people think of when they think of an epileptic seizure or convulsions. There's a condition known as status epilepticus. Just kind of be on the lookout. Whenever you see anything Latin like this, like status asthmaticus or status epilepticus, it's a medical emergency. Status epilepticus is a state of prolonged, uncontrolled, continuous seizure activity or frequently repeated individual seizures that occur without the patient regaining consciousness. The seizure will last over 30 seconds and can cause brain damage. Therefore, status epilepticus is considered to be an emergency, a medical emergency. The drugs for epilepsy include barbiturate drugs, benzodiazepine drugs, carbonic anhydrase inhibitor drugs, GABA analog drugs, hydantoin drugs, succinimide drugs, and other epileptic drugs. I have reordered these slides and the drugs in this chapter with the most commonly used for each disorder being addressed first versus the way the textbook has them. The textbook lists them alphabetically, which sometimes put lesser drugs first because they come first in the alphabet. Starting with barbiturate drugs. Barbiturate drugs will inhibit conduction of nerve impulses in the cerebral cortex and in the motor areas of the brain. They have a long-acting sedative and anti-epileptic effect. They are also considered to be GABAergic. They have a very calming effect and they enhance the effects of GABA. The prototype drug on your drug list is phenobarbital. Phenobarbital is a C4 drug. This drug is known by the brand name Luminol. Barbiturate drugs often have barbital or at least barb somewhere in the name. So here we have that barbital. All the drugs in this class are controlled substances, but there is different schedules depending on what the drug is. So for example, phenobarbital is a C4, which is very commonly used for seizures, but pentobarbital is a C2. Next are benzodiazepines. Benzodiazepines also inhibit the conduction of nerve impulses in the motor cortex. They work very similar to barbiturates, but they're chemically different. They also enhance GABA, that gamma aminobutyric acid, so they're GABAergic, that calms things down. Lorazepam, which is also known as Ativan, is used to treat status epilepticus. The one on your drug list is clonazepam, which is known by the brand name of Klonopin. And like I showed you previously, Valium, as a muscle relaxant, had the V cut out of it. Klonopin, by Roche, the main manufacturer, can have a K cut out of the middle. Klonopin, your benzodiazepines, oh, there's diazepam is another benzodiazepine. It can also be used for status epilepticus, so I've given you an example of it in the injectable form. The physician would use injectable benzos to treat a seizure in a hospital facility. The drug stems for benzodiazepines are azolam or azepam, and all of them, this is the nice thing about benzos, every single benzo is a C4, so it's very consistent. Now, the injectable diazepam is here, but diazepam also comes as a nasal spray or can be administered through an atomized nasal administration. The brand name of the nasal spray is Valtoco. They can take a syringe, and instead of putting a needle on the end, it's got like a little, it kind of looks like a funnel that they can push the plunger down, and it actually causes it to come out as a spray, like a mist, and then it absorbs well in the nasal. It can be hard to try to use a vein if somebody's having an active tonic-clonic seizure because of the convulsions, but it's a little bit easier to kind of stabilize the face and administer the medication intranasally. Other GABA analog drugs, these have the drug stem of GABA. They're going to restrict nerve impulses and decrease nerve irritability. The drugs are used to treat simple partial seizures and complex partial seizures. Gabapentin is not a scheduled drug, which is Neurontin, but pregabalin is. And pregabalin lyrica is a C5. And again, I talked about that in the previous chapter, chapter 5 that I covered. We also use it for a muscle relaxant for pain, mostly for pain. Not a muscle relaxant, but for pain. Pregabalin is a C5 drug. Hydantoin drugs act on neurons in the motor cortex of the brain. They regulate the flow of sodium ions, and that helps stabilize cell membranes and prevent the neuron from depolarizing and repolarizing, which is to send out an impulse to other neurons in a too rapidly or repetitive sequence. Again, it's going to slow things down is really what we're trying to do. With seizures, we have an overload of rapid firing of neurons. We're going to try to calm those down whatever way we can. These drugs are used to treat simple partial, complex partial, and tonic-clonic seizures. They have the drug stem of toin. So we have phenytoin, which is known by the brand name of Dilantin. And we also have fosphenytoin, which is measured in phenytoin units or equivalents. The brand name of fosphenytoin is Cerebix. Cerebix is kept in the refrigerator, and it's administered intravenously. Now, phenytoin can also be administered intravenously, but as a healthcare professional, it's important to note that phenytoin dilantin cannot be administered in a hand or a foot access site. It is a very potent vasoconstrictor, and it can restrict the blood flow to a hand or foot if it's located in a low IV site, like a hand site or a foot site. And then basically, if you think about, have you ever put a rubber band around your finger? it starts to turn purple because you've restricted the blood flow. That's what happens. The restricted blood flow causes a condition that's known as purple glove syndrome. And permanent damage can result from the lack of blood flow. The next drugs I'm covering are the succinimides. Succinimides have the drug stand of succinimide. These drugs are used to treat absent seizures. So these aren't for a convulsion seizure, but for absent seizures. They're not controlled substance, and the drug is ethosuximide, which is known by the brand name of Zerontin. Carbonic anhydrase inhibitors are less commonly used. It's kind of when other things aren't working. This is actually technically considered to be a diuretic drug. They inhibit an enzyme known as carbonic anhydrase, and they stop it in the brain, which keeps it from breaking down carbonic acid, and that results in a buildup, making the tissues slightly acidic by decreasing the pH, and that helps to suppress electrical impulses that could trigger a seizure. This drug is used to treat absent seizures, and it is not a controlled substance. Other drugs that are used to treat epilepsy include cenobamate, Zocpril, or lacosamide, which is VPAMP. Both of those are C5 drugs. Topiramate, Topamax, which is also known by Trokendi XR, is used for seizures, but it can also be used to treat migraine headaches. Other drugs, the ones on your drug list, include carbamazepine, which is known by the brand names of Tegretol or Epital, levetiracetam, which almost everybody mispronounces. It's kind of a hard one. Even pharmacists had trouble with that for a very long time, but it's levetiracetam, and that's known by the brand name of Keppra. Here we have an extended release formulation, Keppra XR. And there's a picture of the topiramate and Trokendi XR. A really interesting thing about topiramate, topiramate when taken, and it will be taken as a scheduled, on a maintenance schedule, not as a scheduled drug, but as a maintenance drug, so they take it daily. It causes the taste buds for carbonated beverage to taste flat. It's kind of a weird side effect. So again, topiramate can be used to treat seizures, but it's also used to prevent migraine headaches. Other drugs used to treat epilepsy or seizures include the valproates. These include divalproic sodium or valproic acid. These have a lot of LASA drugs, look-alike, sound-alikes. So divalproic is Depakote. I used to say Di and Val. Di loved Val's coat, so I could remember which one was which. And then we have valproic acid, which is Depakine, and Val thought it was keen, which means it's an old word for cool. Now the injectable valproate sodium or valproic acid is Depakon. So easy to get those mixed up, but valproic acid and divalproic sodium are actually two different drugs, but they're in the same family. Next are drugs for Alzheimer's. Your book says dementia and Alzheimer's. It doesn't really talk a lot about dementia itself. There are different types of dementia, like Lewy bodies syndrome, dementia. That's what Robin Williams had. Alzheimer's disease is an irreversible progressive disorder that causes dementia. It's a specific type. There are basically three classes of drugs used to treat Alzheimer's, including acetylcholinesterase inhibitors, NMDA antagonists, and anti-amyloid monoclonal antibodies. The most commonly used drugs to treat Alzheimer's disease include the acetylcholinesterase inhibitors. This is a long word. We sometimes take off the acetyl and just call these cholinesterase inhibitors. But what it does is it stops an enzyme called acetylcholinesterase or cholinesterase, which breaks down acetylcholine. Acetylcholine is a neurotransmitter that's important for memory and learning. So in Alzheimer's disease, they have less acetylcholine. So what we're going to do is we're going to increase how much is still working by not breaking it down. The most commonly prescribed drug for Alzheimer's disease is donepezil, which is Aricept. We also have rivastigmine, and rivastigmine actually is got the stereotypical drug stem, which is stigmine for a cholinesterase inhibitor. Donazepam does not. It's a little bit different. These drugs are used for mild to moderate Alzheimer's disease. Then we have NMDA antagonists. They inhibit the neurotransmitter glutamate, which interferes with memory when its levels are too high. The drug is memantine, which is known by the brand name Namenda, and NMDA is part of the brand name. So it almost sounds Namenda, NMDA, they sound similar. This drug is used for moderate to severe Alzheimer's, and sometimes the patient will take something like Aricept or rivastigmine along with Namenda. Then we have a combination. So a combination drug contains an NMDA antagonist, memantine, with the cholinesterase inhibitor donazepam. So like I said, sometimes they take them together. Well, they've actually got one medication that's a combination, and that's known as Neurologic. So Namenda is the brand name of memantine. I can't tell you where the Zaric part comes from. Aricept, I see the airy part. I don't know where the Z comes in. The next specific classification are the anti-amyloid monoclonal antibodies. So I say monoclonal antibodies, you should be saying in your head, ding, 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 MAB, MAB, these are MAB drugs. These work by removing the amyloid plaques in the brain. This is a drug that's administered intravenously once a month, every 4 weeks. The class is known as a disease-modifying drug or an immune modulator, as I've discussed previously with other MAB drugs. Aducanumab is Aduhelm. And of course, that MAB for the drug stem. There are other drugs that are used for Alzheimer's disease. This drug, caprolidine, is axana. And I think of the axon on a nerve and the myelin sheath, which is impacted with plaque when you have Alzheimer's, or the plaque on the cells. It's part of the neurotransmission. If you ever take biology or A&P and you learn about nerve cells, axana kind of makes sense. This is actually a nutritional supplement, and it contains a medium chain fatty acid. And these fatty acids produce ketones in the body that help stimulate nerve cells to produce energy in the brain. This is not a common drug. Next are drugs that are used for Parkinson's disease. So Parkinson's disease is a progressive degenerative disease, and the symptoms are caused by an imbalance between dopamine and acetylcholine. If somebody has Parkinson's disease, their body doesn't make enough dopamine. There's also Parkinson's syndrome or Parkinson's-like disorder. That's when the body's receptors for dopamine are damaged. So the body thinks there isn't enough dopamine. When dopamine goes unchecked, there isn't enough, acetylcholine becomes the prominent neurotransmitter. Acetylcholine is important for muscle contractions. I know previously I was saying that in the brain, it's important for memory. But in your central nervous system, At the muscular level, it's important for muscle contractions. So if there's too much acetylcholine, like what happens in Parkinson's disease, it causes the stereotypical characteristics of tremors and jerking movements that you often see if someone has Parkinson's disease. So the goal is to restore the balance between the dopamine and the acetylcholine. We can do this by either replacing or enhancing the dopamine activity in the brain, or by blocking or inhibiting the actions of the excess acetylcholine. So there are several different drugs, and they'll work through many different mechanisms. Again, I've reordered these, so if you're following with the textbook or even the guided notes, these aren't going to be in the exact order, because the most commonly used drugs for Parkinson's disease are dopaminergic drugs, and there's a number of them. Carbidopa is a dopamine drug that is a carbidopa drug. It's not taken by itself, but it does come as a standalone medication, but it will be coupled with levodopa. Carbidopa allows the body to metabolize levodopa into the active dopamine. Levodopa can't do it on its own. But dopaminergic drugs, many of them will have the drug stem of dopa. So here we have carbidopa. It's got dopa. Lodocin is a brand name for carbidopa. A dopamine precursor, it's a dopaminergic, so it also has the drug stem of dopa, is levodopa. Ambrosia, this is actually an inhaled powder. So it's kind of like when I talked about dry powder inhalers with the respiratory drugs in chapter 6. This is a similar device because it's rapid absorption into the body, but it also comes in a pill form. Sometimes it's just referred to as a dopaminergic drug, not as a precursor, but it does metabolize into active dopamine. Now, most often we're going to see carbidopa and levodopa together as a combination drug, and that combination drug, the most common brand name is Sinemet. So it's a combination of carbidopa, levodopa, and it's going to list out the strength of each of the drugs included in the combination. It comes in many strengths, so we have to know exactly which one the patient is receiving. Another combination drug is I always stumble over this one. Stelvo. This has 3 drugs. It has carbidopa, levodopa, but it's also got entacapone. And I'm about to talk about entacapone, which is a COMT inhibitor. So it's got those dopaminergics, and it's got a drug that's going to increase the body's dopamine levels. So dopamine agonists, they stimulate dopamine receptors. They're going to act like dopamine would in the body. So these are also referred to as dopaminergic drugs. They include the drugs Pramipexole, which is Mirapex, and Ropinirole, which is Requip. Now, these drugs, as well as rotagotine, can be used to treat restless leg syndrome. Now, the textbook talks about amantadine as an dopaminergic drug. Almost every pharmacology book that I access and I use as a resource source does not list this as a dopaminergic agent. It's an antiviral. We do use it in treating Parkinson's disease, but we really don't know the mechanism. It's unknown. It works. We just don't know how or why scientifically. But the author for this book has included it in the dopaminergic drugs. It is available by brand names. Romantine is what it's used for when it's used to treat the flu. But for Parkinson's disease, Gocovri is one of the brand names, and Osmolex is another. So amantadine is actually an antiviral drug. The COMT inhibitor drugs, so COMT, the COMT is an abbreviation for catechol-O-methyltransferase. So again, that's an enzyme. This enzyme will break down dopamine. So we're going to block the enzyme that breaks down dopamine. So when we do that, it means we get elevated dopamine levels. So this drug is called COMT, and we've got that COMT as part of the beginning of the brand name. And tacopone is the generic name. I sometimes for my program students use a resource called Picmonic for them, and I love some of the little images that they use. So here we have kind of like Al Capone attacking the dopamine kind of thing. So the little gangster there, because the drug stem is Capone, like Al Capone. Not completely spelled the same, but it's just one of those memory kind of things. So COMT inhibitors have the drug stem Capone, and tacopone is one of them, and it's known by the brand name COMT. And again, it's going to elevate the levels of dopamine, but it's not acting directly on dopamine. We can also use monoamine oxidase inhibitors in type B. So MAOIs, a lot of times, we'll talk about it in chapter 13. These are also antidepressant drugs, but that would be type A for antidepressant. Type B is used for Parkinson's disease. The drug most commonly used as an MAOI is Celgilene. It comes in patches known as MSAM and Zelapar. It's also given orally. It's also known by the brand name of Eldepril. If we think most patients who get Parkinson's disease are elderly, we can have an association there. It is important to note that there are a lot of interactions with monoamine oxidase inhibitors, because what they do, monoamine oxidase, again, is an enzyme. And monoamine oxidase is one of the enzymes that breaks down dopamine. So by blocking it, dopamine doesn't get broken down. There's more available. So again, it's an indirect on the elevating the levels of the dopamine. Excuse me. But it also blocks any monoamines, or would increase any monoamines that monoamine oxidase might change. That includes serotonin and norepinephrine. So there's drug interactions. There's also interactions with food. So just warning for the patients. They may be on a restricted diet while taking this medication. Next are anticholinergic drugs. Because there's an imbalance between the dopamine and acetylcholine, the acetylcholine levels increase. So we want to block the receptors. So even though it's present, it doesn't cause those tremors. So this is going to help with some of the symptoms. It's going to help manage tremors and drooling. It's going to help rebalance and allow muscles to relax because they're not being bombarded with acetylcholine. Benztropine is the most commonly prescribed, and it's known by the brand name Cogentin. It can be taken orally. It can also be administered through an injection, either intravenously or intramuscularly. It is an anticholinergic, so we are going to have those anticholinergic side effects: dry mouth, blurred vision, urinary retention, and constipation. And we also use acetylcholinesterase inhibitors. This is it kind of seems like it's a little bit backwards, but this is going to impact the tremors. Most often these are going to be used for Alzheimer's disease. And we've got Stigmin, and the drug is Rivastigmin, again, Exelon. Adenosine antagonists are used to treat OFF episodes, which are worsening of symptoms in patients who are already taking carbidopa-levodopa. The drug is istradefylline, which is Neuroxans, and then antihistamines, which have anticholinergic side effects, or the anticholinergic effects. So diphenhydramine, which is commonly known as Benadryl. So it could be used instead of the benztropine. And then the other drugs. So this is an antipsychotic. Am I reading the right one? Yes, these are antipsychotic drugs that treat psychosis that is associated with advanced Parkinson's disease. They stimulate some dopamine receptors and block others. Something called tardive dyskinesia, which is a movement disorder that's characterized by involuntary twisting of the body, swaying, arm movements, head bobbing. It can cause like contractions that can be very painful. It's a drug side effect of long-term treatment with levodopa. So we use these drugs to treat that tardive dyskinesia. The drug on your drug list is valbenazine, and it's known as Ingrezza. They've been doing a lot of advertising for this for people who are on medications that cause those kind of tics that go along with those long-term use. The next disorder is multiple sclerosis, sometimes referred to as MS. So the drugs that we use to treat multiple sclerosis will be covered next. MS is an autoimmune disorder. Treatment includes use of immunosuppressants, disease modifier, muscle relaxants, and anticonvulsants. So first off are corticosteroid drugs. They suppress the immune response. They're autoimmune modulators. We know that the drug stem for these include Asone, Solone, Sonide, and here the drug that matches the one on your drug worksheet is dexamethasone, which is available by the brand name Decadron. We also use interferon drugs. Interferon drugs are also immunomodulators. They decrease cytokines that can cause inflammation. Istradefylline is, what did I do? I think I copied and pasted in my notes. That is not correct. This is interferon beta 1 alpha. So all of your interferon drugs have interferon in them. Again, this is a biological drug where it's expensive, it's kept in the refrigerator, and it's given via injection. Avonex is one of the brand names, and Rebif is another. We also have monoclonal antibody drugs. Lots and lots of these. This is daclizumab, which is known as Zinbrita. And of course, it's got the drug stem of MAB. So this is specific for multiple sclerosis. And then we have S1P modulators. These inhibit an autoimmune attack on the myelin sheath of the nerve cell. S1P stands for sphingosine 1-phosphate. So again, abbreviations, much easier to remember than these crazy long science words, right? So fingolimide, or fingolimode rather, is Gilenya. And these drugs, the S1P receptor modulators, have the drug stem of amode on the end. Now this is taken orally. The fumaric acid derivative drugs, these have fumarate in them, dimethyl fumarate. These work by having an anti-inflammatory effect. Other drugs that we use to treat multiple sclerosis, muscle spasms are very common, so we use muscle relaxants. So baclofen, Lioresal, gabapentin, we talked about those muscle relaxants in chapter 5, and then tizanidine, Xanaflex. These are very commonly used in treating spasticity associated with MS. Other drugs that we use, clodarabine, which is a hazardous drug. It's a chemo drug in the class of an antimetabolite. This drug is also used to treat leukemia, but this is an oral formulation. So we do treat leukemia with oral meds as well. Mavenclad is one of the brand names for clodarabine. It is important because these are cytotoxic or hazardous drugs that if you are handling them, you're wearing appropriate gloves and protection. I know the book doesn't talk about it, but when we get to that at the end of the semester, that's one of the last things we'll cover, are chemo drugs. There are certain regulations and guidelines under USP, United States Pharmacopoeia, Chapter 800, that is specific for hazardous drugs, and it covers anybody who would encounter that, including nursing, as well as pharmacy, the manufacturers, the people who transport it, and then also how to properly dispose. Glutyramate, glutyramine is known as Copaxone. It's similar in chemical structure to the substance in the myelin sheath of the neurons. It helps stimulate T cell lymphocytes that help suppress the inflammatory activity, and it's known as Copaxone or Glatopa, glutyramine. And then another drug that's on your notes is mitoxantrone, which is also a hazardous drug, which is a topoisomerase inhibitor, which also suppresses the immune response. Next is insomnia. With insomnia, patients are unable to get a restful night's sleep. Either they have a problem falling asleep or they have a problem staying asleep. We use hypnotic drugs to treat insomnia. I've got my little Picmonic man with his eyes are wide open. He can't go to sleep. And I always think of hypnotists, right? If you're getting sleepy, as they're waving their watch, pocket watch, to help hypnotize you. They make you sleepy. So hypnotics make you sleepy. These are referred to as sedative hypnotics because a sedative can put you to sleep as well. In the relationship of the two main groups, barbiturates and benzodiazepines, although we use barbiturates less often because they have a higher risk of addiction and there is no antidote if there is an overdose. So as you see here, your book calls it a non-barbiturate hypnotic sedative drug. And I've changed that to a non-benzodiazepine. And I'll talk about that in just a minute. So we're going to talk about the benzos first. So I've already talked a little bit about benzos before. We use them for seizures. They're GABAergic. They increase the inhibitory actions of neurotransmitters GABA. These drugs, temazepam, which is known by the brand name Restoril, right, helps you rest. And even on the brand names, it has it typed on the label that it's for sleep. So the only indication for temazepam is insomnia. Some of your other drugs, like lorazepam, Ativan, which can be used for seizures, in a lower dose may be used for people with insomnia or even anxiety. So the next chapter, we'll talk about anxiety. We'll revisit GABA drugs again, including your benzodiazepines. And again, remember, all of your benzos are C4s. They also have an antidote. Now, the drug stem for your benzos, azolam or azepam. Now, again, as I was stating previously, we group what are sometimes referred to as the Z hypnotics or your non-benzo sedative hypnotic drugs. This includes things like zolpidem, which is Ambien that I have pictured here. It can also include azopiclone and Zopalon. They all have Z in the name. That's why they're called Z hypnotics. Like I said, the book refers to these as non-barbiturates, but the more common way is to refer to them as non-benzos because they are closer in action to a benzo. These are only used for insomnia. These are all C4 drugs. And I picked Ambien as the prototype on your drug list, one, because it is the first, but two, I wanted to mention that patients who take Ambien need to be aware that it has some weird side effects, including amnesia associated with like sleepwalking, even sleep driving and sleep cooking. They just don't remember when they wake up in the morning. That could be a risk if they're out driving a car and they're not fully awake, and if they're trying to cook and they leave the stove on. So those are important things for a patient to be aware of, as well as their family members. So then we have our barbiturates. Barbiturates are an older class of drug than benzodiazepines. Barbiturates are often used for sedation, so we can even use them for anesthesia. This is taken orally. This is secobarbital. It's known by the brand name of Seconal. Pentobarbital, that's pictured in your textbook, is also used. Like I said previously, pentobarbital is a C2, as is Seconal. But when I said phenobarbital, which is used for seizures, is a C4. Now, the drug stem secobarbital, so barb or barbital, is going to be your drug stem. We have orexin antagonists. These block a chemical that regulates wakefulness, alertness, and appetite. These are C4 drugs. We see that on the packaging. And they have the drug stem orexin. And suvorexant is the drug pictured here. It's known as Belsomra. So somnolence means sleep. Bel in Italian or French means good. So this means good sleep. So this is used for people who can't sleep. We want to help them have a good sleep. We can also use antidepressants, specifically tricyclic antidepressants. It's not being used for its antidepressant property, but its side effect of drowsiness. So doxepin is the one your book talks about. It's known as, for insomnia, it's sold by the brand name Selinor. I will make a note, your book does not talk about it, but nortriptyline, which is also a tricyclic antidepressant that has the drug stem triptyline, can be used to treat insomnia as well. And then antihistamines, right? Talked about this back with the respiratory drugs in chapter 6. Diphenhydramine. This is the same drug that's in Benadryl. What's the biggest thing about Benadryl? It makes you sleepy. It makes you drowsy. So they sell it by other brand names to market for insomnia. So we have here Nitol, right? Going to sleep, going to bed. Good night all. Nitol, diphenhydramine. It makes you sleepy. And then Compos, right? You get those Z's, OZs when you're sleeping. These are available over the counter and they're often mixed with other things. Pain relievers. If somebody can't sleep because they're in pain, they'll give them a 1-2 punch. We'll talk about that on a later slide. Then we have melatonin receptor agonists. These drugs stimulate the melatonin receptors. Melatonin is a hormone that regulates the sleep-wake cycle. Melatonin is actually a hormone that's produced in our pituitary gland, not in our pituitary gland, but our hypothalamus. It maintains our sleep-wake cycle. And we have melatonin as a nutritional support or nutritional supplement. And they say on the body that it helps us support sleep. Some people find it helpful, other people not so much, but there's also a prescription known as Ramelteon or Rosarim. So melatonin receptor antagonists, either a nutritional supplement or the prescription medication, Rosarim. And then we have those combination drugs. So this is going to have the antihistamine diphenhydramine with an analgesic, either acetaminophen or ibuprofen or naproxen. Again, if people have pain and it's having, they're not able to sleep, or it could be combined with a muscle relaxant drug like magnesium salicylate to help relax the muscles and help promote sleep. So Aleve is naproxen with diphenhydramine, Aleve PM, and then Tylenol PM is acetaminophen with diphenhydramine. Next are migraine headaches. Drugs for migraine headaches are used to either prevent prophylactic agents or treat what we call abortive agents. These will stop a migraine that's already started. Migraines are caused by a vasodilation. They're very painful. It's usually one area of the head that hurts, like somebody's kind of sticking an ice pick in it. Symptoms can include nausea, sensitivity to light, difficulty concentrating. So again, I reordered the drugs by what are the more common drugs that are used for migraines. And the first ones are the 5-HT1 agonists. So these are going to activate serotonin receptors in the brain that are going to cause vasoconstriction and kind of rule that headache in. These drugs came about in the 1990s. They have the drug stem of triptan, so sumatriptan, and it's known by the brand name Imitrex. It comes in tablet form, it comes as an orally dissolving tablet, it comes as a self-injectable form, and it also comes as a nasal spray. So lots of different dose forms. Many drugs in this class, but you're going to identify all of them using that drug stem of triptan. So we want to help somebody. An agonist helps, activates somebody with a migraine. The newer group of drugs, which have been probably about 5 years or so, the CGRPs, and these are CGRP antagonists. So CGRP stands for calcitonin gene-related peptide. So this is a chemical that activates a migraine. So we're going to block it. So we're going to use a CGRP antagonist. These are can be preventative or they can be abortive. So a patient can use it if they've already got a migraine. The thing with the triptan drugs, the 5-HT drugs, they need to take those as quickly as possible as the onset of the migraine to have the biggest impact. The CGRPs can be taken even after the migraine's been present for a little bit of time. So they can be used to either prevent or treat, and there's two groups. We're going to either have a monoclonal antibody or we're going to have an oral formulation. So the monoclonal antibodies end in Numab. Here we have Arenumab, which is Aimovig. And then we have Galcanezumab, so Zumab or Numab, can be kind of Zumab in general. Emgality. So we see these are both injectable. They are pre-filled auto-injectors, so the patient takes them home, keeps them in the refrigerator. If they have a migraine, they can use them. And then we have oral formulations. So we have Rimapent, which is Nurtec, and we see these on TV a lot. This is an orally dissolving or disintegrating tablet, ODT. They put it in their mouth, it dissolves. Again, a lot of times people who have migraines feel nauseous, so to have them try to swallow a pill might not work because they might end up having emesis. But this is going to dissolve and get into the bloodstream very quickly. And then we have Ubrelvy, which is Ubrelvy. One of these, I know Serena Williams is on the TV ad for one of these, and Khloe Kardashian is on the TV commercial for the other. So these are both going to be orally dissolving. So we see with these Ubrelvy, they're in little packages to protect them from the moisture. This has the little foil protection on top, and you just pop them out. So again, the drug stems, Japant or Zumab or Numab is going to be your drug stems for the CGRP antagonist, your migraine modulators. To prevent migraines, we may use beta blockers. People also use beta blockers if they have hypertension, but the one that's used to treat migraines, or prevent migraines, I should say, to be correct, would be propranolol. It's known by the brand name of Inderal. The patients would take this every day. This is a prophylactic agent for migraines, and it ends with the drug stem of OLOL. All beta blockers end with that drug stem. We also have ergotamine drugs. These drugs are used to treat a migraine. In the old days, this was the main drug that was available. Going back, I'm thinking back into the 70s. It comes from a mold that grows on rye. plants. So patients who have mold allergies probably shouldn't take these drugs, or they may have a reaction to these drugs. What happens is it causes vasoconstriction. So again, migraines, there's vasodilation, and that's part of the booming, boom, boom, boom feeling that somebody has in their head, because the blood is just coursing through their veins, and it's like all in their head, and they almost feel like every time their heart pumps, their head feels like it's gonna just, that blood is hitting the skull kind of thing. It's very painful. So this is going to cause vasoconstriction. It's going to help calm that down. These drugs all have ergo somewhere in them. So this is dihydroergotamine, so the ergo's in the middle. And the brand name for this is Migranol. So it's a drug to treat migraines. Other drugs to treat migraines, I did mention in chapter 5 that we had Excedrin, which is a combination drug. It contains acetaminophen, aspirin, and caffeine. Why it's not noted in this chapter, I don't know, but it talked about diclofenac, which is an NSAID. Cambia is a brand name for the migraine, and then Advil migraine, which is ibuprofen, which is also an NSAID, and we know sometimes NSAIDs are associated with the drug stem of Profen. Now there are other drugs, and that includes botulinum toxins. So onabotulinum toxin A is a neuromuscular blocking agent. It gets injected into 7 specific muscle areas in the head and neck, and it helps prevent migraines for up to 3 months. Another drug is topiramate, which we've seen on a previous slide for seizures, as well as valproic acid and divalproics, and those would be given orally. So those are some other options to help prevent migraines. And then we have combination drugs. So this is Cafergot. So it's a combination ergotamine and caffeine. So caffeine, ergo, Cafergot. Next, we're going to talk about diseases and conditions of nerves, including neuropathy and neuralgia. So neuropathy is a term that means disease of the nerves. We use neuralgia, nerve pain, or neuropathic pain as a descriptive, and they can be treated with a number of nervous system related drugs, including anxiety, anti-anxiety agents, antidepressants, anticonvulsants, as well as topical anesthetics. And then RLS, which is restless leg syndrome, is in this because it causes kind of a pins and needle feeling. And that's what we have here, right? This is the image from your textbook. When people have neuropathy, they kind of, it feels like their foot's asleep or whatever part of the body is being affected, and it gets all tingly and it can be painful as well. Kind of like little pins and needles are sticking into their skin or into their muscles. So again, I like my little Picmonic images. So this is their neuropathic pain image. So antidepressants used for neuropathy and neuralgia include your SNRIs. And this here we have Cymbalta, duloxetine. So I talked about that when we were talking about pain previously in chapter 5. So Cymbalta, not a controlled substance, but pregabalin is. And pregabalin is Lyrica, and that's also used for neuropathic pain. That is a C5. This is an anti-epileptic drug. So antidepressant, Cymbalta, anti-seizure drug, Lyrica. And again, we've got that GABA. It's a GABAergic. It's going to calm everything down. And it's going to help with those pins and needle feelings because it's calming all of those nerves. We also use dopamine receptor agonists. Rotigotine is Nupro. And we kind of got nerve, that new in the nerve. And this is a patch. So it's going to give a systemic amount of drug over a consistent period of time. And then we can use opioid analgesics. So pentadol is Nucynta, and this is a controlled substance. This is related to the opiates that we talked about in chapter 5. So we know most opioids are C2s. And then we have topical agents. So we talked about capsaicin again in chapter 5. So it could be a topical prescription, irritant anesthesia, or something over the counter like capsaicin that we see here on the Salonpas hot. Prescription, it would be something like lidoderm, which is a transdermal patch, lidocaine. And then the last item is RLS. RLS is restless leg syndrome. These drugs are also used to treat Parkinson's disease. So we have pramipexole, which is Mirapex, and then ropinirole, which is Requip. And like I said, these are also used for Parkinson's, but these may be taken for people who have restless leg syndrome. That usually impacts people at night when they're trying to go to sleep. They get these kind of, not quite a cramp, but kind of a spasming and some pins and needle feeling, usually in their legs. That's why it's called restless leg syndrome. Okay, so let's finish up the questions.